This is a 64-year-old patient with myelodysplastic syndrome who resided in a nursing home and was found in the morning on the floor. Scrolling the CT scan, one can see that there is displacement from the midline at the level of the septum pellucidum. We'll measure once again. You notice that when I measure from the midline, I'm going from the falcian attachment to the bone spicule anteriorly to the bone spicule of the occipital bone posteriorly, and that is how I define the midline. And then the septum pellucidum seen between the frontal horns of the lateral ventricle to that line measures 11 millimeters or 1.09 centimeters. Fool me once, shame on you. Fool me twice, shame on me. As you can see more clearly in this example, the white matter of the juxtacortical white matter does not go all the way out to the periphery, and therefore this is yet another example of an isodense subdural hematoma. Let me draw the cortical margin for you. Here you can see the edge of the cortex. You also note that further anteriorly we convert from an isodense subdural to a hyperdense subdural hematoma. This suggests that the patient has had multiple episodes of bleeding, including one more anteriorly that is more acute. In addition, you can see that the patient has blood products that are acute along the falx. Now, just to reiterate, how do we know that this is an isodense subdural hematoma and not an isodense epidural hematoma? Remember, crescentic shape and crossing sutures, in this case, the expected location of the coronal suture, would identify this as a subdural collection. Scrolling further superiorly, you can see the mixed density collection anteriorly and the isodense portion more posteriorly. For those of you with relatively good eyes, you probably have already identified the contralateral isodense subdural hematoma. Here again, we have the white matter that is not going all the way out to the periphery, and therefore there is indeed another isodense subdural collection on the contralateral side in the left frontal and parietal region. This becomes less dense posteriorly, and again makes the assumption that the patient has likely had multiple episodes of head trauma leading to different age blood products in the subdural space. This patient, by virtue of the size of the subdural hematoma and of the degree of midline shift, would undergo neurosurgical evacuation.